Yes, and we're back here in What's Up, of course. Together with me is my good-looking co-host,
Thank you
Dr. Rayran Lao.
to our host, the good-looking Dr. Cenica.
Yeah, thank you
Happy
very much.
Valentine's.
Yeah, happy Valentine's. Of
Yes.
course, again, happy Valentine's to our televiewers. And we've been talking about all about Valentine's
Yes,
shape, how to
napakaganda
get in
ng-
shape during Valentine's.
Yes, napakaganda
you know?
ng topic natin kanina, Dr. Cenica, the nutritional effect,
Effect.
ng Javita.
And how
Para
to lose
sumeksi.
weight
Yes,
using
para
a nutritional
sumeksi.
support.
And right now,
By just merely drinking
coffee.
what's up, Doc? I mean, coffee.
Yun,
A
oh.
bitter shake.
Pero right now, ang second segment natin, we'll be discussing about the liposuction or the surgical
The
part
surgical part.
ng
Yeah.
pagpapasexy. And
Ayan.
ang guest natin is the president ng society natin, Dr.
Oo.
Cenica, no?
Can you introduce? We'll give
Yes,
you the
she is
privilege.
the fellow of the Philippine Society for Cosmetic Surgery,
Yes.
president of Philippine Society of Liposuction Surgery,
Uh-huh.
treasurer of Philippine Society for Cosmetic Surgery, treasurer of Asian Pacific Academy of Cosmetic Surgery. Napakadami.
Presidente na, treasurer pa.
Yun. At napakaganda pa. Ito yung pagpupunta ka sa convention na pansinin na doktora.
Oo, kasi
No other
talaga-
than Doktora Charrie Ballecer.
Ballecer.
Good afternoon, Doctor.
Good
Good
Charlie.
afternoon. Happy Valentine's to all the televiewers and especially to the very handsome hosts this afternoon.
Yes.
napansin
Thank
ko
you for having me
naka-red si Doktora.
Oo nga,
Yes,
dapat-
Valentine's Day.
Ako naka-red din yung aking tie. Oh.
Oo, sa
Dapat
akin,
nag-red ka.
yan,
Underwear.
yan, underwear.
Okay, okay, that's good. Anyway, Dr. Ballecer, can I call you Charrie?
Sure.
Yeah, now, I know you've been so much engrossed about what you call Vaser Liposuction.
Liposuction.
Okay, what's this Vaser? What's the difference between Vaser Liposuction
And the
traditional standard liposuction surgery?
Okay, to start with, Vaser stands for Vibration Amplification of Sound Energy at Resonance.
Wow.
Okay, the difference between Vaser and traditional lipo, there are a lot of differences. First, Vaser uses ultrasound technology to do body
Ultrasound?
shaping for
Okay.
liposuction. It does precise tissue selection for the aspiration of the fat. It first emulsifies the fat before extracting it.
Okay.
And well, there's better patient recovery because of lesser pain and lesser bruising after the procedure. So I
Okay.
think those are the main highlights of the difference.
So, I mean, do you harvest more fats in comparison with the standard liposuction procedure using this Vaser liposuction?
Yes, from experience, you're able to remove more fat in one sitting.
Okay.
So the retreatments are lesser
Okay.
than with standard liposuction.
Okay. Doktora, how many ml is the maximum na pwede
Volume.
pong tanggalin? O volume na pwede pong tanggalin ng Vaser?
Okay, I'm quite conservative, but the good thing about Vaser is since you're selective, you're removing fat. So usually, in my personal practice, I normally would remove a maximum of 2,500
Wow,
cc's of
that's
fat.
a lot.
Okay.
And that's a lot, and that's pure fat.
Pure fat.
So you're not really afraid that there's a lot of bleeding because everything is so precise, and there's also a fluid management system that causes it to be precise.
Oh.
Where does this Vaser liposuction originate? Is that here in Asia or Europe or in the United States?
I particularly trained for Vaser in Bologna, Italy.
Italy.
Yes,
Yeah.
so the Italians are very good at producing these machines. The Europeans are also very, very conscious about their figures. So I believe, for me, I think it started in Italy, but I'm not sure because what I know is my professor, Professor De Giuseppe, said that there are a lot of doctors. They have formed sort of a relationship among the doctors abroad to make a study of the ultrasound. And
Okay.
I particularly studied it in Bologna, Italy.
Bologna
How many years na po, Doktora, ang Vaser sa Philippines?
market.
I trained in 2008.
2008.
Liposuction has been here since 1997.
1997.
So we were also the first ones in the Philippine Society for Cosmetic Surgery who started liposuction.
Okay.
But I started really doing Vaser 2008. So it has been here for the past 7 years.
Okay, for our televiewers, we would like again to tell you about the cell phone number that you can join in our discussion. You can text us at 0998-647-4407 or 0922-891-6761. Again, please indicate your name and your address where you are at right now. And we will be discussing all about Vaser liposuction. This is not the standard liposuction. It's going to be, parang kumbaga, ito yung upgrade ng lipo.
The
Okay?
gold standard of liposuction.
The gold
gold
standard
standard
of
of
liposuction.
liposuction.
So there's what you call, is it the same thing as like the ultrasonic liposuction? or we call it an external liposuction, external ultrasonic external liposuction.
Okay.
Yeah.
Yes, John. External ultrasonic liposuction is done externally.
Mhm.
Okay, you have a machine that you use on top of the areas that you want to do liposuction on.
That's true.
And you analyze the fat there. In my case, it's internal ultrasound
it's
liposuction.
integrated already.
Internal.
Yes,
Okay,
it's
okay.
integrated. So what you do
Yeah.
is after doing all the safety measures, you have to lyse the fat. Then before extracting or aspiration of the fat. That's what makes the procedure very, very good and pretty much different from the regular liposuction.
So, mas less, doktora. Mas
Less on trauma, lesser pain, less bruising, faster patient recovery equals happy patient.
And for the doctors, doktora, medyo mas less yung pagod din.
Oh yes, on the
Yes.
physician's part, first you have lesser
Less effort.
surgeon's
Yeah.
fatigue, and second is happier patient, which is the most important.
May tanong ako, doktora, compared sa traditional lipo and Vaser, pinapatulog din po ba ang pasyente?
Is it on
sa Vaser?
sedation?
Sedation din
Yes,
po ba or
oo.
under local lang?
Pareho rin sila. Depende sa aalisin mong
Fats,
fats, and depende sa lugar na aalisin mo.
Okay.
So in my particular case, normally patients would ask a lot of Vaser requests for the abdomen, for the
Abdomen,
thighs,
yes.
for the back.
Right.
So I normally put them to sleep because they will be more comfortable.
And also very comfortable on the part
Very
of the
comfortable on
physician.
the part of the physician and on the part of the patient because they are less anxious.
Okay. Can you do Vaser? Sorry, doktor.
Yeah, you do-
Can you do Vaser on the face? Or on the
Yes,
chin?
on the
Pwede
chin.
rin.
The chin.
Yes, I've done Vaser on the chin.
Okay.
I've done Vaser practically on all parts of the body.
All
Wow.
parts of the body. Wow.
Okay.
Nice.
What are the the risks and indication of Vaser liposuction?
Just like any other surgeries, Vaser also has risks. But in the hands of an experienced liposuction surgeon, the risks are so minimal and even nil. Because this particular procedure is so precise. We even have precision fluid management for it. And remember, I have tissue selection because I do not hit the other structures that support the skin and the dermis because
Okay.
I'm focused on the fat, which I lyse before extracting it.
Okay. So wala siyang, doktora, may nakikita kasi tayo na sa traditional liposuction paminsan na nagkakaroon ng discoloration.
The bruise.
Yeah,
The bruises, the after effect.
Dito sa Vaser, it's minimal.
It's minimal. Pwede kang magkaroon ng bruise, pero minimal lang. At saka mabilis ma-resorb, mabilis maalis.
How many days, doktora, makakapag-resume sa work ang mga nagpapa-Vaser?
Yeah.
If I-
Downtime.
Downtime, I'd say 1 day lang.
One
One
day.
day.
Yes,
Wow.
because
So that
after
means-
that, I even send them home after the surgery, after recovering
So this is
for a
an
few
outpatient
hours.
procedure?
I can
pwede?
do it on an outpatient basis.
So
Okay.
kinabukasan, pwede ka na maggagalaw?
Oh yes,
Uh-huh.
yes. I have a lot of patients who have themselves done on a weekend,
Okay.
so that they can go back to work,
Work
on
on
Monday.
Oh,
They
okay.
just have to wear
Galing,
the
no?
support
So you don't need
garments.
to go. Do you still advise that after liposuction, what will be the post-op care or advice that you can give after this Vaser liposuction?
Well, in the first place, the fats that I remove will permanently be gone. However, they have to modify their lifestyle.
Okay.
so-
Yes.
And, diet and exercise will still be will play an integral part of their lifestyle.
Okay.
So, if they want to maintain, I always teach patient behavior modification.
Yes. It's the
Yeah.
nutritional
Yes,
support.
it's the
Yes.
nutritional
So
support.
Very important. Not
Yes.
only that you undergo liposuction and you get that particular body post-operatively for the rest of your life, but you have
Yes.
to maintain, sabi nga ni Doktora, still the lifestyle.
Still
Yeah.
the lifestyle.
Kasi there's a lot of question. A lot of patients come to our clinic and ask this particular question: that is it permanent? If let's say you undergone Vaser liposuction, is it permanent, the fat removal, and you will not gain weight anymore?
No, as I've said, they still have to have behavior modification. The fats that I remove will permanently be gone. But naturally, we have to leave some fats there.
Yeah.
So hindi
For-
talaga inuubos
Oh,
for
hindi
the
mo
viewers.
ubusin ang
Yeah.
fats.
May
So that
matitira po tayo.
yung matitira doon,
It will grow back pag tagalang hindi mo hinayaan.
yes, they will
Pinabayaan
be
mo sarili mo.
influenced by whatever lifestyle. If it's a bad or sedentary lifestyle that you have, then you can regain the fats on those fats that I left behind.
Yes.
Yeah,
We
pwede
have
mo
a
explain.
texter from cell phone number ending at 5868.
Yes.
Doctor?
Is there any bad side effect on the long run? June Lopez of
Palawan. Yeah.
Doktora?
There's no bad side effect, June. I've done lots of them for the past 7
7
years.
7 years.
And I've seen Vaser patients who are very happy. But then again, it's on the doctor's part, we really have to, as I've said, orient them as to how to modify their behavior and lifestyle. Hindi mo naman pwedeng pababayaan mo lang ang sarili mo.
Yes,
After the procedure,
So
kailangan mo
mag-exercise ka pa rin.
alagaan.
Alagaan mo ang sarili mo sa tamang pagkain, sa tamang lifestyle.
Yes. Doktora, marami nagtatanong sa mga guys naman. Guys na mayat at naiiwan yung male breast or
Male breast,
gynecomastia. Pwede bang tanggalin ito ng Vaser?
Yes, in fact, other than surgical excision, Vaser is the treatment of choice
Treatment of choice.
for liposuction of the gynecomastia
For the
in
male breast.
males.
Oh, okay.
Because it can really flatten the male breasts.
Talaga.
Yes.
Napapansin natin, Doktora, na-avoid ba niyo yung minsan na alon-alon na complication ng traditional liposuction?
Definitely, kasi ang Vaser nga, siya nga ang nagko-correct nung
Oh.
alon-alon from other liposuction cases than the conventional
Yes.
way.
Because we have seen several patients who undergone the standard liposuction, and post-operatively after several months, you can see some waves on the abdomen or the
Depressions.
arms, and I think Vaser liposuction is the answer for all these problems. You know,
Yeah,
and
in
I
fact,
think, yeah.
that's right, John. In fact, that's one of the indications. Yung mga secondary cases na kailangan ulitin because the patient is not happy because may waves. Yung primary liposuction procedure niya.
Right.
That's one of the best indications. And it is able to get rid of the waves. And it gives you a better skin retraction and smoother contour.
Yeah, how about the skin elasticity of the patient using Vaser liposuction in
In the
comparison
first
with the
place,
standard one?
Okay, in the first place, mas magandang skin retraction sa Vaser. However, admittedly, there are patients who have very poor skin elasticity already
Yes.
because of pregnancy.
Yes.
So
Yes.
that has to be explained kasi baka mamaya she would need a liposuction with a little tummy tuck.
Tummy tuck.
Yes.
There you go.
Tummy tuck is abdominoplasty.
Abdominoplasty,
Okay.
that's removal of excess skin.
Okay, Doktora. Marami rin nagtatanong, Doktor, about excessive underarm sweating or hyperhidrosis.
Okay.
Nako-correct ba ito ng Vaser?
Yes, it is good that you asked me about hyperhidrosis because I do hyperhidrosis liposuction procedures even on teens.
Okay.
Because that's
Oh.
when they get to have very active sweat glands that
So,
we are able to suck out.
What do you
with
remove
Vaser.
during procedure if there is if you do hyperhidrosis? What part of the layer of the skin
It's
or fat?
it's mostly the sweat and
The sweat glands.
yeah, the sweat glands that we remove.
Okay.
Is it permanent, Doktora?
It is permanent.
Is it
Oh.
permanent?
But I always tell the patients, I may not be able to remove everything because you need your sweat glands
Yes,
pa rin.
definitely.
Yes.
So I'd probably be leaving 20% behind.
20%.
Yes.
So at least magandang good news ito sa mga televiewers with
I know.
regards sa hyperhidrosis.
Minsan, that's especially for women.
Yes.
You know,
Conscious sila with
very
regards
conscious
dito.
because makita mo,
nakamark.
they have like a wet underarms, and it's very embarrassing
Yeah, so
for a
very
woman
good,
or a man to see that you have a wet
Yes, ating
underarms.
televiewers, Vaser.
Vaser
is
liposuction
one of
is
the
the
good-
answer.
Yes.
Okay, Dr. Lao, you know, we have still our third segment. We'll be also
Ang bilis
again
na ubos na sa
joining
segment
to get a Valentine shape,
Yes. We will
and
combine.
together with the surgical and the
The
nutritional
yes,
support.
oh.
We'll be talking probably later on, and we'll have a hanging question that is Vaser liposuction enough, or do you need a follow-up like a nutritional support after Vaser liposuction?
Yun.
And that question will be answered when WhatsApp Doc returns.
Natural lip nose lift, cleavage by breast augmentation, curves by liposuction, non-surgical treatment of varicose veins, Janssen Cosmetic Surgery by Dr. John Cenica.